Hello, everyone, and thank you for joining the 9th webinar in our Pandemics and Society series. Today's event is Artificial Intelligence, Rewards, Risks, and the Future of Biosecurity by Design. Today, we will be diving into the relationship between AI and biosecurity, with a focus on how AI will benefit biopreparedness and why that makes it vital to address and integrate biosecurity now as a key component. I'll now pass it to our moderator today, Dr. Beth Cameron, who is a professor of the practice and senior advisor to the Pandemic Center at the Brown University School of Public Health, to get things started.
Thanks so much, Aquiel, and thanks everyone for being here today to join this important discussion. There is no doubt that artificial intelligence will significantly accelerate the life-saving benefits of the biotechnology revolution. Equally, there is no doubt that it will accelerate the potential for misuse of biology to cause harm. Both of these statements are true, but what is less clear, I think, is how we'll tackle them simultaneously, moving beyond a discussion about managing risks and maximizing benefits of existing AI-enabled tools and toward a conversation about whether, and if so, how, these tools might be designed simultaneously with safety and security outcomes in mind, and how we can accelerate that work. There's been a lot of discussion in the news, in the academic press, in governments around the world about the convergence of artificial intelligence and biotechnology. Its uses for medicine, food security, climate security, pandemic preparedness, and healthcare, as well as the risk that these tools will enable states or terrorists to wreak broader and more catastrophic harm. In recent years and months, governments and scholars around the world have put forth policy recommendations to boost biosecurity measures in AI development and to create safeguards against harmful incidents, including the recent executive order from the Biden administration on artificial intelligence, which included a biosecurity component. So where does this leave us? To help us unpack this issue, today we are incredibly fortunate to be joined by three brilliant leaders and friends, each of whom has a wealth of diverse knowledge and experience in this space. I'm joined today by my friend and colleague, Dr. Andrew Hebbeler, who is the inaugural Director of Biosecurity at the Coalition for Epidemic Preparedness Innovations, CEPI, which is focused on strengthening and speeding vaccine development in order to work towards equitable health security on a global scale. Welcome, Andrew. We're looking forward to hearing more about your new role and your work on the 100-day mission and biosecurity. We're also joined by Ms. Claire Qureshi, who is a leader in biosecurity at Effective Giving. Effective Giving is a major philanthropic organization and independent nonprofit focused on helping major donors find and fund solutions to the world's most pressing problems. Welcome, Claire. And last but certainly not least, we have Dr. Lynda Stuart, who is the executive director of the Institute for Protein Design at the University of Washington and a world leader in this field. The Institute for Protein Design creates proteins to solve today's challenges in medicine, technology, and sustainability. Welcome, Lynda. So thanks to all of you for joining us today. Your decades of experience in science, biotechnology, biosecurity, and the intersections of those disciplines with AI make you a uniquely capable team to help us really dive into the topic at hand. Additionally, you're all working together on principles for responsible use of protein design. So we're hoping to get a little bit of a sneak peek into that effort and how you're thinking about this work and what it's all about. Before we start, I'd like to encourage everyone to be candid, to jump in when you agree or disagree with one another to enhance our learning. And we'll kick things off with a few initial questions to each of you. We'd also like to ask our viewers to please feel free to utilize the Q&A function so that we can answer your questions later on in the discussion. So let's dive in. Welcome to all of you. It's so great to be with you today. I want to begin by acknowledging that there is a ton of discussion, as I said, about risks associated with the convergence of artificial intelligence and biotechnology. But I really want to begin here by asking first about the use cases, about the benefits. I want to hear why we're so excited about this acceleration of biotechnology that AI can bring, because I think a really clear understanding of the benefits of that work will be essential to help our audience more clearly think about ways to prevent and manage risk. And so I'd really love to ask Lynda if she could kick us off by talking about her perspective on the intense promise of AI for creating new protein design tools. Welcome, Lynda. Please kick us off.
Thanks very much, Beth, and thank you very much to the organizers for putting together this great webinar on this, what I think is a very important topic and the invitation to talk. Maybe before I jump into protein design, I'll just give a little bit more of my background, which I think maybe places this in some relevant context. So prior to becoming the executive director of the Institute of Protein Design, I spent 10 years at the Bill and Melinda Gates Foundation, where I led vaccines and biologic discovery, including leading their pandemic response for 2 years, collaborated deeply with CEPI, working globally to try and ensure equitable access. And then I spent a brief period of time at an mRNA company, BioNTech, in charge of infectious disease. And through that sort of 10-year arc, one of the things that I was always searching for were transformational tools that would really allow the world to be a safer and healthier place. And one of those tools in 2014, as an example, that was mRNA, which, at the time was a notion, but was something that I saw as being totally able to transform how we do vaccine development. So fast forward now to why am I now at the Institute for Protein Design? It's really because I see in the AI-enabled protein biodesign tools the same transformational and game-changing opportunities for not just medicines, but also climate sustainability across many, many avenues. And this really is, I think, one of those once in a century, once in a lifetime convergences of protein design as a field with artificial intelligence and machine learning coming together to allow us to now generate completely new proteins that can have really quite extraordinary properties that are beneficial. So as an example, during the pandemic, the Institute for Protein Design designed little mini binders that could stick onto a virus and block that virus from infecting a cell. Back then, which was 2 years ago, we did this extraordinarily fast. We did this in 6 months. At the time, it was extraordinarily fast. And now, through the new tools that we have, the computational tools and the AI methodologies, that can now be concatenated down to something we can do in 6 days. And in 6 days, 5 of those days are spent waiting for somebody to ship us DNA so that we can make the design. So this is the sort of game-changing opportunities we see ahead of us with the new AI-enabled biodesign tools. So I want to just also, Beth had asked me to explain a little bit what these tools are, and I think it's important to understand them and how they differ from sort of the large language models. So these are computational methods that allow us, that have been trained on every protein structure that exists, that allow us to be able to use those computational methods to generate hypotheses and designs for new proteins. And I say hypothesis because what the AI methodologies do is to give us a design, but that design is just something on a computer. And it's only in the transformation of that design through expression, through DNA, into a product, into a molecule, and what we call this digital to physical transition, that has to happen, right? So unlike large language models where the output of the AI may be, a deep fake image, the output of the AI in a protein or biodesign tool is not in itself something that can ever be harmful. And I think this is a nuance that's really important for people to understand, because downstream of that, there are many safeguards that we'll hear a little bit about that can happen downstream of that. So I'm super excited about these tools, partly because of their enormous applicability and to almost anything in biology and also materials. In the context of a pandemic or outbreak, I think these tools can be very rapidly leveraged for diagnostics, for vaccines, for biologics. So any countermeasure, we can very rapidly design. And I think one of the things that for me is very important about understanding this is that if you look back at all the pandemic responses that have happened, the first responders are often the academics, the public health physicians, they're people at the front line. It's not in behind pharma walls that these things occur. And so having access to these tools so that those first responders are able to use them is really important. And this is why it's something that I do not think should be locked up in a pharmaceutical company. So access is very important. And the other people who need access are the people who are often at the front line of outbreaks, which are people in low and middle income countries in Africa. And this access is not just to the tools, but also I think it will be really important moving forward that we have access to the compute power that allows people to use these tools efficiently. So I see enormous opportunity. I recognize also that there are concerns and there are risks, and we're going to talk a little bit about those today. But I really wanted to open this conversation by really putting on the table, there is so much upside that we can benefit from, that we must be thoughtful about how we enable that, while also, of course, being responsible in our utilization. So I'll stop there, Beth. I hope that was helpful.
That was incredibly helpful, Lynda. We're fortunate to have you in the position that you're in at this moment in time with the background that you have. I think it was also incredibly important to hear, and for our audience to hear, that there are differences both with how and what these tools can enable virtually versus physically, and what that means for our work to manage risk. And so I'm really glad that you unpacked that a little bit, and we'll be talking more about that and about equitable access as we move forward. Andrew, I want to turn to you to talk a little bit about the specific benefits that these tools bring in the pandemic preparedness realm. You have a new job at CEPI, and it's the first time CEPI has had someone focused on biosecurity. I'd love to hear a little bit about your position, and also why you're excited. Why are you focused on artificial intelligence and the intersection with biotechnology and biosecurity?
That's great. Thank you so much, Beth. And I totally feel like I'm in the midst of one of those I'm not worthy moments following Lynda, Stuart, and sandwiched between you and Claire, but just excited to be here and also talk about this really timely and important topic. So you're exactly right. Yes, I'm in a new position, and the position I'm in at CEPI is in a new role. For those of you out there in cyberspace, you're probably familiar with the CEPI organization, which is a really innovative partnership that was launched in 2017 among civil society, private partners, industry, and governments with the goal of stopping epidemic threats. Our focus is on trying to accelerate vaccine development against epidemic and pandemic threats, and a key sort of organizing priority for CEPI is the 100 Days Mission, which is giving the world the capability to develop safe and effective vaccines within 100 days of the emergence of future epidemic or pandemic threats. And if there's one thing that drew me to CEPI more than anything else, it is that bold, ambitious agenda, an inspiring agenda to help to accelerate the development of this capability for the world. I think, my role at CEPI was created really as a recognition that in order for us to achieve that goal, we have to conduct the research that we are supporting safely and securely. And as stewards of global public funds, we have a responsibility to work to prevent the epidemic and not inadvertently cause the epidemic or pandemic that we're working to prevent in the first place. And so it was really that recognition that led to the deepened collaboration between the Government of Canada and CEPI that allowed for the Canadian contribution that actually created my role. I landed in this new role last August, so relatively new. But what we are working with great diligence at doing right now is developing CEPI's first ever biosecurity strategy. And that's going to cover a range of areas, both strengthening how we manage risks associated with infectious disease research investments, but also working to build coalitions across the health security spectrum that will allow us to unleash the power of emerging biotechnologies and converging technologies, while also being wide-eyed about risks and working to reduce risks associated with these extraordinary new opportunities. So that's kind of the context. We have been actively working over the last few months to leverage our convening power to bring together stakeholders from across sectors for exactly the same kind of discussions that you're supporting here today, which is really bringing, the broad range of perspectives to bear, so that we can figure out how best to maximize the benefits of artificial intelligence, while also working actively to both recognize and reduce risks. We have supported a range of functions, including on the sides of the UN General Assembly, bringing stakeholders together for a very preliminary discussion. We are springboarding that into a convening at the Munich Security Conference next month that's going to be focused around a simulation. So we're just excited both to raise awareness and to identify concrete ways that we can reduce risks associated with these investments. But your question is, what are the benefits? And there are many benefits. And as Lynda said, it's not just in the health sphere. We're talking about, as Lynda wonderfully put it, a once in a century opportunity of the introduction of a technology like this that's going to have wide-ranging transformations across society. And this is going to be far beyond health, to include agriculture and environment, and a range of other sectors. In the health domain, in particular, in relation to CEPI's mission and mandate, which is preventing epidemic and pandemic threats, we see an extraordinary array of beneficial applications of AI. This includes utilizing AI to strengthen our early warning system so that we're actually able to detect epidemic or pandemic threats soon after they emerge, so that we are actually in a position to achieve the 100-day mission and the 100-day goal. We see the use of AI as an extraordinary tool for both outbreak prediction and outbreak forecasting. So this includes both proactively identifying, at some point in the future, epidemic or pandemic threats before they take hold. And once they do emerge, having the capability to understand with relatively high fidelity how they are likely to move through communities and move through the global population, so that we can tailor our interventions and response efforts accordingly, is going to be an important potential beneficial application of AI. But there are a range of other areas as well, improving how we do clinical trials, both defining endpoints, finding patients, figuring out how to recruit the right people. And importantly, we see AI as having extraordinary benefits in vaccine and monoclonal antibody design. And of all of these areas, that's probably been the area that we are making the most investments, and where I personally have been most focused over the last few months. But we are actively right now thinking through how we can wield AI for biomanufacturing to improve the production of vaccines and other biologics when they need to be produced at population scale. And ultimately, using AI as a tool to help understand the etiology of outbreaks, and in the event of deliberate misuse, potentially even attribute those outbreaks. So this isn't a comprehensive list, but hopefully begins to describe sort of the array of extraordinary areas that AI can be brought to bear to support not just CEPI's mission, but this ambitious global goal of the 100 days mission, and being able to produce vaccines and biologics within 100 days of the emergence of future threats. So maybe I'll leave it there. I'll turn it back to you. But we're just super excited about all of the beneficial applications.
Thanks, Andrew. And one of the things that really excites me about your new role is that it takes this idea, which you and many other people at the nexus of health and security for so many years have had, which is taking a big idea like the 100-day mission and actually building into that idea, the idea of safe and secure design at the same time, and trying to actually figure out what that means. It's exciting. I'm sure it's daunting, but really excited to have you in that role. Claire, I'd like to turn to you, and I'm going to move into the question about risk as well. When I do, you have a broad, like Lynda, like Andrew, you have a broad background where you started your career looking in global health, you've worked in community health. you've moved to roles in biosecurity and also artificial intelligence, and are now at a philanthropic organization that's really thinking deeply, I think, about these issues and how to get it right. I'd love to ask you for your perspective on benefits, but at the same time, I'd love for you to kick off what I hope will be a discussion amongst all three of you about the risks. And the question there, I think, is really what keeps you up at night now, but also, I think, really importantly, and as you heard, as we've heard Lynda and Andrew lay out, there's a difference between what can happen now and what we might see in the next 5 to 10 years. And frequently, I think in our biosecurity and public health field, we have technology sort of moving down a track, and we have the biosecurity community sort of saying, we're worried. But converging those conversations has historically been quite challenging to do in the moment. I think you found yourself in the nexus of a number of those types of conversations. I'd love to hear your perspective, and then would love to turn it over to Lynda and Andrew to also talk a little bit about the risks and the realities that you're concerned about.
Sure, happy to do so. And again, thank you so much, Beth, for having me here, and to the entire team. Andrew, it's been wonderful being a thought partner, and Lynda as well, to seeing the work you've done at IPD. And learning so much from that. Just as brief background, as Beth alluded to, my career's had a couple of different chapters, and the first really was on global health. And I was working with the Office of the WHO Special Ambassador, trying to scale up community health at the front lines and thinking deeply about the systems, tools, technologies, financing, best practices, approaches to take great examples of community health systems and scale those globally. One thing we found, of course, is that the role of technology can be a tremendously helpful enabler, but it isn't of itself insufficient for solving the challenges and ensuring access. But we worked quite a lot, and that was 10 years ago. And it was interesting reflecting on this, even in the short window since I've been involved directly in community health, the technology, again, has leapfrogged so greatly that, my understanding of really how AI is being utilized at the front lines is already stale. And I think that's a good reflection and reminder that what we're building and thinking about today is going to be outdated almost as soon as we say it. But really, in those, what I understand, and, a lot of great work's being done by the Gates Foundation, by Rockefeller and others, and USAID, to look at really the use cases for AI at the population health level, but also as decision tools, both by patients and by providers, to help really upskill and help decision-making. And then, also enable, scans to be read and to help with a lot of those technological challenges. So tremendous benefits. And again, as Lynda said, and Andrew, I want to make sure that even as we think about policies and regulation, that we're not undermining those potential benefits as we do. The second chapter of my career was a very short one, but intense. And like all of us being involved in the COVID response, I was at a biotech company, Novavax, for 2 years, helping them launch their COVID vaccine. And while not utilizing the mRNA technology, we were able to rapidly go from sort of phase 1, phase 2 to phase 3. But we were tremendously affected by manufacturing challenges. And I think a lot about, if we'd been able to use AI for, and again, I'm not a manufacturing expert, but to smooth out a lot of those manufacturing challenges, gosh, we would have had many fewer batches that were out of spec. We would have had supply chains that worked better. We would have had delivery in country more efficient. And I wonder, again, if there are opportunities to use AI, to use this technology, to not just optimize the vaccine, but also to optimize the path of vaccines and countermeasures getting to patients that need them. So I'm really excited about that frontier. And I'm sure there are a lot of colleagues involved in manufacturing that are trying to integrate that tool and technology. And then the third chapter, and most sort of relevant here, is on the biosecurity front. And I've been thinking as part of a group called Helena in the past year about this nexus of AI and bio. And then, as Beth said, most recently at an organization called Effective Giving, where we're really focused on biosecurity and pandemic preparedness. So as I think about risks, again, and to Beth's prompt, it's really important to be nuanced in the near term versus long term. I'm happy to give my thoughts, but I also want to mention there's a tremendous community out there. Folks like Jonas Sandbrink in the UK, Anjali Gopal and Kevin in the US, Richard Melange, Tess Alexanian, Samuel Curtis, others who are really going deep on a lot of the technical challenges and complexity around AI. And I would encourage anyone who's interested to start really reading up on those papers. The thinking is evolving almost by the day. So the question really is, what incremental risk does AI times bio pose above the existing biosafety and biosecurity risks? and especially those amplified by synthetic biology. So just to back up, one of the most exciting and also concerning developments for biosecurity, even before AI, has been the advance of synthetic biology and the ability to use tools like CRISPR to modify pathogens. Of course, there's tremendous upside. Almost every day in whatever newspaper, there's a great story about how CRISPR is being used for a new biotech innovation. But the biosecurity community has become deeply concerned, especially by the proliferation of the technology and also the democratization, lowering the barriers to entry. The threats being created when we imagine a world where these tools are being used in their negative downside dual use case, being manipulated potentially by both states and non-state actors or quasi-state actors to build bioweapons that are more transmissible and more virulent than anything nature can create. As many on this call know, there's often a trade-off for viruses between transmissibility and virulence. And if you can think about overcoming some of those, what feels like otherwise a trade-off, you can imagine an engineered pathogen being even more concerning. So now we have AI. So we've got CRISPR and synthetic biology, and now AI. So what's the incremental risk? To me, I think it's important to delineate between, and Lynda started to do this, sort of large language models and what they can do to help sort of upskill lab workers, and then also biological design tools, which is what Lynda spoke to in depth. So first on LLMs, many of you on this call, especially if you're in school or using AI every day for a variety of ways and different means, and you're very familiar. And critically, LLMs for the most part are not providing new information. They're just making it easier and quicker to access information, whether that's on how to think about a mortgage or how to buy a car or how to plan a trip. And in this case, maybe also how to build a bioweapon. As Rocco Casagrande and others have pointed out, really just pointing to long-standing biosecurity weaknesses, helping close those information gaps faster, potentially for bad actors. There have been safeguards built around these models, but there's a potential for them to be jailbroken. And there's been some interesting work lately, hackathons and things where people can actually look at jailbroken versus safeguarded models and what is the potential for harm that those two examples are causing. And one particular area of concern is around releasing the weights of models. No matter how robustly foundation models are safeguarded, if you tell people how these weights are aligned, you can actually undermine any safeguards that are built in. So that's been something the community's been thinking about. The other concern, in addition to sort of the proliferation of access and the democratization of that, is raising the overall ceiling of harm. And the concern is that a tool like a biological design tool, a protein design tool, could actually assist in the engineering of biological systems and really increase the overall virulence of the pathogens that are well outside of what nature could create. So I'll leave it to Lynda to speak in more depth about how BDTs actually work. But in a sense, they serve very targeted purposes like protein design. They're trained on small sets of data, amino acid sequences, and they learn properties of a biomolecule and also make suggestions on options around them. Folks like Jonas Sandberg again in the UK have said that BDTs may enable the creation of a pandemic pathogen substantially worse than anything seen to date, and could enable forms of more predictable and targeted biological weapons. So in his words, really increasing the worst case scenario. Now, I want to be clear. I think when many folks are thinking about these worst cases, that's really, in my mind, and based on the data I've seen, several years out. I think today the concern is around the trajectory, but in time, and I think it's something that Andrew and the team developing the MSC scenario, thinking about making sure we're considering 5 years from now and working backwards. What safeguards do we need to be building in now to make sure that we're resilient to that 5-year future? There's been examples of BDTs, driving toward compounds like VX. So with simple changes to how models are penalized and how different inputs are penalized or rewarded, you can see these models taking things in a very concerning direction. The other thing to think about, and I'll wrap up here soon, Beth, I promise, is what happens when we start to couple these tools. So if you have an LLM, for example, which I agree with Lynda to the most extent, is not the outputs from it are not, the BDTs, for the most extent, the outputs by themselves are not a concern, but how they are used could be. But if you start combining these tools, so an LLM with a biological design tool, with a factory or lab that's run autonomously, it starts to become a cascading and very concerning set of environments where the control and the safeguards, have the potential to break apart relatively quickly. And because we know that some of these concerns on biosecurity are offense dominant, meaning it's much easier for bad things to happen than to put in countermeasures to stop them, we need to be really proactive, in my mind, about building those biosecurity measures in upstream and not waiting to see a problem and then to start kind of, taking that silo of biosecurity and back solving to integrate it with the broader puzzle. So, in my mind, there's risk today, but there's even more risk on the horizon. And what we need to do is be thinking proactively about building this in, making sure that there's biosafety, biosecurity as part of the design and use of all of these tools.
Thanks, Claire. And I'm really glad that you put on the table some of the different categories of risk. And this is incredibly simplistic, and I am not a computational biologist. But one of the ways that I've been thinking about this with help from the experts that are here today is one, large language models today are helping accelerate knowledge. We can get more information more quickly. It doesn't necessarily create new information. It might create more misinformation if the information that's out there is actually not good. Biodesign tools allow us to do more with that information. And we have biomanufacturing, we have DNA synthesis tools, and we have obviously basic lab work that allows us to take that information and turn it into, for example, a pathogen that could be misused. And the connections between those three things are not at a point right now where, for example, a bad person could take all of those things and nefariously put them together and create something immediately that would necessarily cause harm. But a lot of research is happening on the linkages between them. And right now is an incredibly important time for people who are developing those tools to be thinking about how we can mitigate risk. So that's a much more simplistic way that I know that the folks that are actually doing this work are thinking about it. But I would love to hear, Andrew, Lynda, if there are ways that you could take something that you're doing. So for example, the 100-day mission or some of the work at IDP, how does this translate, this idea of building in responsible practices? How does it translate into something that you're actually focused on and doing? And also, what are you worried about? And do you agree that these are things that we should be focused on? And if so, maybe if you have views about what we should or shouldn't worry about, that would be also great to hear.
So maybe I'll start off, Lynda, and then I'll pitch to you. So maybe just a few quick thoughts. One is might be eye roll inducing, which is that this term biosecurity, we've been talking about the confusion over this term for probably 15 years. And I just want to emphasize sort of, the traditional sense of biosecurity that we're really approaching this from, which is preventing the deliberate misuse of the technology to cause harm. I think that we have recognized for quite a while, and CEPI is taking a much more expansive view to biosecurity, more akin to what we think of as health security, but with a focus on preventing deliberate misuse and also the safety issues and preventing practitioners that are handling high consequence pathogens from getting infected and subsequently infecting their community. I say this because if we're going to effectively manage risk associated with these technologies, we've got to be clear about what risks we're actually trying to address. And at the same time, as we're trying to strike the right balance between benefits and risks, we also have to recognize that not leaning into the benefits fully also comes at risk, and we need to be taking that into consideration in this calculus as well. And this is a point Lynda and others continue to emphasize, and I just want to underscore that for the group. The second point that I wanted to make was that what is endlessly fascinating about these kinds of discussions is just the multiple areas of expertise and experience that must be brought to bear in order for us to figure this out, to get this right, to strike this right balance. I am not an AI expert. I am learning as I go. I'm learning from leaders like Lynda and others about the details of the AI technology itself. But the perspective I do bring is, a career that's been spent on identifying and managing risks associated with high consequence pathogens. And as we think about how best to wield the AI technologies for benefit and avoiding, reducing risk, we need to be cognizant of the range of safeguards and security measures, the multi-tiered defenses that many countries and the world have put in place to manage risks associated with high consequence research. And, I heard both Lynda and Claire talk about this important concept of the digital to physical divide. And when I first approached this topic, what I kept saying to myself is there aren't any unique vulnerabilities that AI is exposing. And that's not actually totally accurate. I'm saying that from my perspective as a person that's focused on all of the tiers of control we are implementing in the physical world. There are obviously some unique aspects of AI technology itself, and there are, as Claire has mentioned, some AI-specific mitigation measures that we are employing, and we are considering, and we should continue to considering, evolve, and implement as appropriate. But the point is, I don't think there is ever going to be a silver bullet to manage risk associated with AI infectious disease challenges. And I think our best approach is probably going to be many layers of defense at different critical checkpoints. And I think as many of us have begun to think about where critical checkpoints are in this AI bio nexus, the role of DNA synthesis and its capacity to produce translate the idea to a physical product that then has the potential to expand exponentially just as a function of, synthesis, protein synthesis. I think that's why many of us are focused on that as like a critical node. And actually in the recent US executive order, this was an area of focus. And I think we should continue to figure out how best to manage that interface. And so you asked for a concrete example. That is a very long-winded way to get to the answer to your specific question, which is, where we have been focused, at least in recent months at CEPI, is trying to figure out how we can accelerate vaccine immunogen design for novel threats that emerge so that we are positioned to achieve the 100-day goal. And we have over the last year announced a series of investments in different groups, including the Houston Methodist Research Institute and IDDL, Leipzig, that are actually representing broad consortia of academic players that are all contributing either different data sets, different scientific capabilities, or different AI technologies with the goal of rapidly identifying suitable vaccine targets. In order to achieve that goal, though, you have to find ways to access all the data commonly and apply the AI algorithms. And so a big focus of our work over the recent months has been how we can create a safe and secure platform for this kind of exchange and this kind of function. And how you do that is really important because you've got a lot of different stakeholders that have different approaches to managing cybersecurity. So you have different elements in terms of how data is contributed. You also have different elements you have to think through in terms of users that will actually access that platform and those data. In some cases, there are subsets of data that actually have information risks, security sensitivities. And so figuring out how you strike the right balance between openness and sharing, while also control and managing potential security sensitivities, that is what we are actively in the midst of. And the thing that has become abundantly clear in all of these discussions is that while we're thinking about balancing the open scientific benefits with the security sensitivities, it has become totally clear that these also have clear equity implications because, ideally we are trying to create a global resource that leverages the full breadth of capabilities and data across the world that will allow us to design the best vaccine candidates that are matched and safe and effective for the most vulnerable communities where the vaccines will be needed the most. And if we don't have a means of articulating clear, objective, and transparent criteria for the security requirements in order to participate in this endeavor, we are inadvertently missing opportunities for important stakeholders to contribute resources or capabilities. And so for us, this isn't just a security issue. How we strike this balance and how we get this right also has really important equity implications. And so for us, striking this right balance is just critically important. But that's a tangible example of how we're working to address these issues.
No, I appreciate that. And I'm glad that you brought us to equitable access. And equitable access, I think, both to the tools and technologies, as well as equitable access to equitable application, I would say, of oversight requirements and access to funding for built-in biosecurity measures. When we think about the luxury to be able to assess risk, we also have to think about the role that funders play in allowing their grantees and those that they are working with to actually address those issues. It requires people, it requires training, and that's something that I think also needs to be equitably distributed so that we can get to equitable distribution of tools and technologies. Lynda, I'd love to hear both your view about the risk, importantly, coming from where you sit at the forefront of developing these tools and tech, but also would love to hear your thoughts about I know you're working and these are not out there yet, but a little bit about the responsible use principles that you've been working on together with Andrew, Claire, and a group across the country, and whether those tools are, whether you're envisioning those principles as domestically focused, or are those going to be globally applied, and how?
Yeah, so Kate, maybe to talk about the risks, and I think, what is actual now versus what are we planning for in the future is important, right? Where we are now is not, I don't think there's major risk today, but anticipating where we may get to is and building the risk mitigation in at the upset. I think Claire really nicely articulated an interesting problem, which is bringing together, large language models or natural language interfaces with design tools, with some sort of automated lab. And although that seems very hypothetical at this point in time, there's progress being made in each of those areas very rapidly. And I think, each of those areas should continue, and, they're all very, very important. But where we maybe need to have a really deliberate kind of, and coming back to the layered approach, right? The deliberate efforts are the intersections of when those things come together. Because I think those are probably the critical choke points that we can focus on and really, if a natural language model is talking to an AI biodesign tool, it shouldn't talk about bad things, right? It's a kind of very simplistic way of thinking about it. But if you could say that was somehow monitored and prevented, that would be a really easy choke point to kind of deal with. And then similarly, this design to physical is an interesting place. It's actually quite challenging to monitor and handle for some because the way we deal with DNA screening and so on is probably not going to be adequate moving forward, because it really only screens for things that exist. It can't screen for things that are totally novel. But we do think monitoring that interface is important because it provides an audit trail back to anybody who's doing anything malevolent. It's very easy to say somebody has ordered something on this DNA synthesizer that, and this is the person who's ordered this, that's bad. So I think we should think about that. And I think the DNA synthesizer risk that is important is not just these automated lab, but a lot of the benchtop synthesizers that are not being monitored by companies like Twist and GeneScript and so on are very conscientious about this activity, but it's really the benchtop synthesizers that add a new level of we need to think before they get widely rolled out. We need to think about how we secure them. And so I would say that one of the things, David, who is, the leader in this field with George Church, have been speaking about is bringing in better plans for controls around DNA synthesizers and benchtop synthesizers. I think those are, and so I very much agree with this idea of these layered approaches. This all began in the summer. We were, David, David Baker, who's the person who has really led the field in biodesign, and I were chatting, and we were like, well, what is there? Is this a hypothetical risk or not? So we started having conversations with internally at the Institute for Protein Design, and then with the broader protein design community. And we started building this sort of consensus around, we should have some guiding principles for how this community operates, self-regulates. So for the past 6 months, we initially were leading this internally, and then in a smaller effort. And then we had a convening which brought together a lot of really great people, including Claire and Andrew, to really help the community think through this. And those principles are now being developed more broadly, and very much with an eye to an international and global principle set, because there's no point just focusing one country or the other. And so we had, a lot of international leaders in protein design involved, and so on. And so they're in development, and I think they speak to guiding principles, because we do not think they are rules that you can lay down in such a fast-moving field. You need to have a principle-based approach so that it can evolve with the technology as the technology changes. That part of responsible application of biodesign tools is both, in securing them, but part of that responsibility is also using them for good and making sure that that's maximized. So maximizing benefit, minimizing risk. But Claire and Andrew have been really involved in all of this, so maybe Claire can speak to this, but it was been a great pleasure to have started something at the Institute, and for it now to be something that I think is now, hopefully going to really impact this field. But
yeah.
Please.
No, Beth, if you want to jump in, and I'm happy to comment more specifically.
No, jump in, please.
I think that the point around, again, the norms and principles are not intended as a silver bullet or a solve for any of these complexities, but to the discussion of sort of building in layers of, capacity and governance, tools and screening mechanisms, norms and practices like this, and then the funding to make all of this happen as sort of a picture, right? And I think the norms and principles that are being developed by this group of protein designers with some support from policy folks like Andrew and me is a great example of a first step toward that norms and practices piece. And, can there be sort of a groundswell of more work like that to say, what are these core cruxes, these tension points between openness and security, for example, and how do we as a community of protein designers in this example, or a community of, folks involved in autonomous manufacturing, like what are these tension points in our own community, and how can we build in safety and security sort of upfront rather than as a down the line kind of thought. So it's really been a pleasure to be involved in that. And I just want to comment also, I think, Lynda, you were talking about these connection points between the BDTs and the LLMs and factories, and whether those are autonomous or actual physical factories with people involved. It struck me this fall as we were talking about some of the export controls, for example, and some of the screening around the physical materials, that our laws and practices around digital information are much more archaic and are grounded in and based in, a world where there was essentially classified or unclassified information in science. And those are the two categories, and everything else, we'll figure it out. But I think as we think about where we are as a world and the connectivity between researchers globally and how fast information can flow, I would really encourage policymakers to think about, are there other ways that we should be considering information and data and creating safeguards around that information and data that is, updated for the world that we live in now. And then again, thinking about those safeguards in the context of this bigger picture about where pathogens could actually be created. So just wanted to add those couple points.
Well, and let me jump in. I know you want to get to questions, Beth, but just very quickly, I feel like we're at this somewhat narrow window. I don't know how long it will last in the early discussions on this. And one of the roles that CEPI is trying to play is broadening the global aperture so that these aren't discussions that are just happening in a small subset of countries, but really taking into a broad range of considerations and perspectives and stakeholders across the world. So we hope to continue to lean into that in the coming months and find opportunities to really widen the aperture and get a broader array of stakeholders to the table. The other thing, just very briefly, is lesson learned from biosecurity work and managing biosecurity risks for so many years, is that this isn't a static problem. This is highly dynamic. It's evolving very quickly, and we're going to have to continue revisiting what our perception is on risk, both objectively, so that we can continue to evolve the ways that we are approaching to manage that risk in a way that's commensurate with the pace and the way in which the risks themselves are evolving. But the awesome thing about the work we're doing to develop these responsible principles, they'll be great to serve as an organizing principle, but then it will be up to institutions and practitioners to implement. And so it will be critical that we continue to find ways to come together and share perspectives and experiences on how we're actually taking the principles and integrating them into our actual operations. So we're doing this in a meaningful way and in a way that's tailored to the wide range of research settings that exist across the world. And so just excited, just thank Lynda and the University of Washington for their leadership on this, and just excited to be a part of the process.
And I'll just also say that it's not an accident that there isn't someone from government on this panel. We have former government officials on this panel, but nobody current. And one of the reasons for that is because the technology is moving so quickly. We really wanted to hear from practitioners, people who are at the forefront of funding, designing, and bringing together coalitions to get big projects like the 100-day missions done. I really think that government can play a role in setting norms and standards here, and ideally, putting in funding for biosecurity by design. But I think it's up to you and to us to really implement this work. And that's daunting, but I think it also makes the work that you're doing even more important. We do have questions. We only have 7 minutes. So here's what we're going to do. We're going to bundle a few of the questions, and then I'll also give you guys, after the bundling of the questions, a lightning round 30 seconds to say anything you want to make sure you say, / anything that you are most excited or worried about and want to see happen going forward. So first, quick bundling, we'll do a lightning round answers, and then 30 seconds to a minute. So that's how we'll run it. We have a few questions. I'm just going to bundle 3 of them together. There are a few that we're not going to get to. Apologies to the group. These are great questions. Some of them are similar, so I'm putting them together. So we have a question from Catherine Budeski, who is a former friend and current friend and former colleague to some of us. She is asking about the role of our community in thinking about distribution regulations of core technologies. And she's thinking here in the AI space about advanced semiconductors in China. So I think just to summarize her question, what is the role, how can we avoid consolidation of these technologies in certain countries? How are we thinking about equitable access to the tools, the actual component parts we need for these tools to work? We also have a great question here, a couple of questions consolidated. They're basically about how are we thinking about cybersecurity as it relates to these tools in the United States and globally, both in our healthcare system as we're developing more tools and technologies, but also I think in biodesign tools more broadly. And then the last question that I'll put out there on the table, not the last question that was asked, this one is about Meta's announced plans to develop a larger than ever large language model and to release it open source. How should we be thinking about that? And are there measures we should be thinking about in advance? And I think the broader question there is, are we concerned about this? So I'm going to ask who wants to jump in first. Feel free to answer some or all of those questions, and then I'll come back to you guys for a really quick lightning round.
Can I jump in on the first one because I feel very passionately about that? So that really is around the importance of not consolidating and maintaining equitable access. And with that, implicit in that is also some level of openness in the community so that everybody can be, engaged. So at the IPD, we're very aware of this. We kind of, the Institute has grown up hand in glove with the Gates Foundation and has a very strong kind of global health perspective and presence. We are actually in the process of trying to put in place a sort of collaborations with people in the global south to start training people to use our tools so that they could be used in for regional, needs applications, be they designing antivenoms for snakes or working on local pathogens or outbreaks or whatever. So we're really very interested in sharing, and we have an open access principle and generally for all of our tools. The access will also require somebody to think about computational access. And I think that's a really critical part of this being equitable, is that somewhere, AWS, Azure, Oracle, whoever it is going to have to solve the cloud issue. But with that will also have to come the security around the use of those, those tools and really having globally applicable regulations and application. But we are actively building in equity in everything we do. But that's really why it does have to be a global endeavor and can't be siloed and consolidated in, just Google's isomorphic labs.
Thanks, Lynda. I'm glad you got that on the table. And given the time, I think we're going to ask Claire, Andrew, and then we'll come back to you for the last word, Lynda, to throw in any final pieces of answers or anything else that you want to get on the table. 1 minute each.
Sure, I'm happy to start. So first on that last question though, on the Meta announcement, and again, I'm not as close to detail as I probably should be, but Meta signed on to the voluntary commitments on CEPI AI. They're also, this model release will be subject to the stipulations of the EO. So I think we need to be thoughtful about what are the voluntary commitments pieces, what is government doing, what action should Congress take, and what should we think about from a liability perspective, for example, so that even while companies are rushing to get these tools out, which is great in one hand, they're incentivized to also build in safety from the start and to think about all the potential downside cases of the way these could be used. The other thing I was going to say is just on terms of what I want to make sure that we're thinking about. One is it's not about undermining these technologies or putting them back, in the box. It's about maximizing the value. And just as with any type of product where we want to make sure that we're getting the most from our pharmaceuticals that are manufactured or airplanes that are made, I think we all want to get the most from AI and emerging technology. So let's figure out how to do that. Let's build in security from the start. And let's think about, as we're setting precedent in the US, how can we push that out also globally and with partners and allies, but working with other countries that may be more challenging to work with, but are absolutely essential given the pace and scale of their industries. And last thing is to say, these risks are potentially catastrophic, but they don't have to be if we can be really thinking about, why these pandemics matter, what we can do today to be prepared for the future, and to keep a pace with the capacity, with the tools that we're building to stay ahead of the risk landscape.
Thanks, Claire. Andrew.
Well, I'll be very quick and just say the first question is particularly important to us, and we're doing it in at least a couple ways. One is just, in terms of the projects we're designing, they're really kind of setting the model that will inform how we ensure broad, diverse, and inclusive participation in these endeavors in the future. The second major way is we're a research funder, and so we actually have the ability to support research that not just expands the capabilities in this area around the world, but also does so in a way that is responsible, is safe, is secure, and is aligned with responsible principles for AI use. And so we're just excited to continue to explore that. And hopefully, as we move forward and as the biosecurity work at CEPI matures, we'll have opportunities to work in partnership with partners to build capabilities that will maximize the benefits while minimizing potential risks. And so I'll leave it at that, and then we'll, I guess, turn it back to you.
Yeah, Lynda, do you have a last word before we close?
Nope.
All right. Thanks, everyone. I want to thank everyone for participating today. I'm sorry for those whose questions we didn't get to. There was a robust set of them, and we weren't able to get to all of them, but I think the discussion was incredibly rich. I want to extend a very hearty thank you to our panelists and to everyone who joined us today for such a productive discussion. But in particular, just the three of you, I think, represent the dynamism around this issue. And I'm so glad you're working with a large group and together on this issue. I can't think of better people to help solve this problem or help create solutions along the way to multiple problems that will be raised and will pop up. And then finally, to everyone who joined us, thank you so much for being here. If you'd like to share this event with anyone who is unable to attend, we will be posting the recording on the events page of the Brown Pandemic Center website next week. You can also find recordings of all of our previous webinars there. Please do follow us on our social media accounts to learn about future events and webinars, and reach out to the email address that's on the screen with any questions or suggestions for future webinars. We do take suggestions from our audience for how we can be most useful to you. So with that, I'd just love to thank Lynda, Andrew, and Claire. Thanks again, and to everyone who watched. Have a great rest of your day.
Thanks, Beth.
Thanks, Beth.
Bye. Thanks.